Good afternoon, everyone. My project's about reducing opioid consumption in the surgical setting at Bridgeport Hospital. As we all know, there's currently an opioid epidemic, and this continues to pose serious challenges for healthcare, with addiction and patient safety being of top concern. The initiative focuses on decreasing opioid use by introducing a multimodal pain protocol to improve patient outcomes and cost savings for the hospital. So in my research, I found some interesting data. One paper described how the 2000s really introduced pain as a vital sign, and this really led to patient satisfaction with their pain scores being a top priority. And so a lot of opioid prescriptions were being written and given. And over the last 20 years, we've seen about a 4 times increase in opioid-related deaths. So in the year 2000, it was 8.2 people per 100,000, and in 2020, it was 32.6 people per 100,000. The opioid epidemic currently is estimated to be costing the United States $1.02 trillion as of 2017, and it's estimated about 80% of surgical patients receive an opioid prescription after they've had their procedure. So this is a big area for potential improvement in healthcare, and by reducing opioid consumption in the post-operative setting, we could really help to fight this opioid crisis. So there was a study that I read conducted by the University of Virginia and published in the year 2020, where they implemented a multimodal pain management protocol for nearly 8,000 patients. And their data showed a 40% decrease in the amount of opioid prescriptions written, and also a length of stay decrease by about a day and a half on average. They also saw a 15% reduction in overall hospital costs post-operatively, and they primarily attributed this to the shorter length of stays and the reduced opioid-related complications. So this study served as a model for the initiative that I'm suggesting for Bridgeport Hospital. And in our study, our objective will be to introduce more non-opioid analgesics such as Tylenol, NSAIDs, and gabapentinoids preoperatively, and also offer more nerve blocks. The nerve blocks can really help with intraoperative and postoperative pain for the patient. Postoperatively, we would also be looking to increase the amount of non-pharmacological pain strategies, as well as utilize the non-opioid pain management strategies as much as we can. So our study initially is going to focus on the surgeries area of Bridgeport Hospital, which handles primarily adult outpatient surgeries. The idea is to implement this in phases. So the first 6 months will purely be data collection on current opioid practices, current pain management, current pain scores, and then provide an education phase where we educate staff and we roll out this protocol and we start educating patients on the benefits of multimodal pain management, as well as on the opioid crisis currently. And then following the implementation, we will collect data for 6 months about opioid prescribing practices, pain management techniques, and patient pain scores, as well as adherence to the protocol and, the non-pharmacological pain strategies also offered. Beyond the clinical outcomes, this initiative also promises significant cost savings for Bridgeport Hospital. Studies show that multimodal pain management can reduce opioid prescriptions significantly, and this leads to direct cost savings of approximately $100 to $300 per patient. The Yale New Haven Health website estimates that Bridgeport Hospital performs about 12,000 surgeries per year. So this $100 to $300 per patient sums to $1 million to $3.5 million in savings annually. If we use the University of Virginia average reduction for hospital length of stay of 1.5 days and multiply it by the 3,000 inpatient surgeries that Bridgeport Hospital conducts, then we get a cost savings of $7.5 million. Opioid cost or opioid related complication costs are estimated to be about $3,000 to $6,000 per patient. And even if we use a very low number of complication rate of 1%, we're looking at about $500,000 on average annually saved in opioid related complication rates. So in total, we could estimate conservatively that Bridgeport Hospital could save between $9 million and $12 million just from this protocol initiation. For this protocol to work, we will need everyone's participation, and that includes surgeons in prescribing non-opioid pain medications and also planning for nerve blocks. The anesthesiologists and CRNAs will be responsible for administering the nerve blocks as well as intraoperatively opting for non-opioid pain management. Nursing staff will need to monitor the patient's pain levels, introduce non-pharmacological pain interventions, and also offer non-opioid medications as their first and second line medications. Patients will be educated ahead of time and also need to participate and cooperate with the non-opioid pain management protocol. And then we will also need the technology to collect the data and compare the data once we collect it. We will use morphine milligram equivalents to compare our opioid consumption pre and post intervention, as well as patient pain scores using the numeric pain scale. We'll also monitor protocol adherence percentages and how often nurses are using the non-pharmacological pain management approaches. We will also collect data on hospital length of stay and cost data related to patient care postoperatively. We anticipate outcome numbers similar to the University of Virginia, and we hope to see a 30% reduction in opioid consumption within 7 days postoperatively. We also would like to see an improvement in patient pain scores by 20% at the intervals described, and we would like to see fewer opioid prescriptions written. In total, 30% reduction is expected, and we would like to see a 20% increase in non-pharmacological interventions used. In conclusion, this multimodal pain management initiative at Bridgeport Hospital is not just a response to the current opioid crisis, but it's also a proactive approach to improving patient care and reducing healthcare costs. We would like to see a reduction in the amount of opioid prescriptions written and consumed to help with the current crisis, and also we can see a benefit of $9 to $12 million saved for Bridgeport Hospital alone. This initiative would hopefully be the start to a nationwide change and could potentially serve as a model for other healthcare systems. That is the end of my presentation, so I will take any questions. Thank you.